8 more of the most brutal medical procedures that still happen today, and some of them will absolutely send shivers down your spine. When most people think of brutal medicine, they think of ancient history or picture blood-soaked battlefields, amputations without anesthesia, but modern medicine still has a few procedures that can make medieval surgery seem tame. That's why today we're counting down some of the most intense procedures in all of modern medicine. Brace yourselves and let's dive right in. Number 8, awake nasal fracture reduction. We're starting part 2 with something that sounds pretty straightforward on paper, but can be surprisingly miserable in real life. Fixing a broken nose while the patient is still awake. A broken nose may not sound like the most brutal procedure, but here's the catch. Many nasal fractures are actually reduced while the patient is fully conscious. Doctors numb the area with local anesthetic, but the patient is still awake, still aware, and still very much present. Doctors perform what's called a closed nasal reduction, manually guiding the broken bones back into their normal position without making an incision. Patients often describe intense pressure, loud crunching or cracking sounds, and that deep facial discomfort that seems to radiate behind the eyes and through the entire face. Some even say the sound is almost worse than the pain itself. On the discomfort scale, this can easily reach a 7 or 8 out of 10, especially once swelling has already set in. So why go through all of that? Because your nose is so much more than a cosmetic feature. It's made up of delicate bones and cartilage that help support your airway. They don't always heal where they belong. And if doctors wait too long, usually more than a week or 2, the bones begin healing in that crooked position. Number 7, an escharotomy. Now this next procedure is one that almost sounds absolutely backwards. Someone suffers a devastating burn, and the treatment, doctors intentionally make even more cuts to the area. While it may look brutal, it can literally save a person's life or limb. With severe 3rd-degree burns, the outer layers of skin become something called an eschar, and instead of acting like normal skin, it turns thick, leathery, and incredibly stiff. The problem is, your muscles don't stop swelling just because the skin can't stretch. As fluid builds up after the burn, pressure continues rising underneath that rock-hard layer of burned tissue. Blood vessels become compressed, circulation begins to slow, and if the burn wraps all the way around an arm or a leg, it can literally choke off blood flow to the entire limb. Using a scalpel, surgeons make long incisions through the burned skin to release the pressure trapped underneath. As dramatic as it looks, those cuts are often made through tissue that's already been destroyed by the burn, allowing the healthier tissue beneath the room to expand again. From a visual standpoint, this is easily one of the most shocking procedures performed in modern medicine. Number 6, bone marrow biopsy. It doesn't involve massive trauma or huge surgery. What patients feel during it is something they'll probably never forget. Doctors perform this procedure to help diagnose serious conditions like leukemia, lymphoma, severe anemia, multiple myeloma. Now, getting a small sample of bone marrow may not sound all that intimidating. That is until you find out where the sample actually comes from. Usually from the back of the pelvic bone, right near your upper buttock. Now, yes, doctors numb the skin and surface tissues first, but here's the part most people don't realize. The goal isn't just reaching the bone, it's reaching the soft bone marrow hidden inside of it. Using a specialized biopsy needle, doctors carefully work through the hard outer layer of the pelvis until they reach the marrow, where blood cells are actually made. Even with numbing medicine, patients often describe a deep pressure, twisting, and pulling sensation that feels like it's happening somewhere your body was never meant to feel anything at all. Doctors attach a syringe and draw out a small sample of liquid marrow. And a lot of patients describe that single moment as one of the strangest sensations they've ever experienced. Almost like a powerful vacuum pulling from deep inside the center of the bone. Number 5, awake brain surgery. Now, this next procedure sounds like something straight out of Silence of the Lambs. It's called an awake craniotomy. And while it may sound unbelievable, this is a very real procedure that's performed to help remove brain tumors or treat certain forms of epilepsy. Here's the incredible part. The brain itself doesn't actually feel pain. It has no pain receptors. That doesn't mean the entire surgery is painless. Patients are not awake for the whole procedure. Doctors use anesthesia while opening the skull and scalp. But once the brain is exposed, the anesthesia is carefully lightened and the patient is awake for one very important reason. So while the patient is awake and talking, surgeons can stimulate different areas of the brain and ask them to answer questions, identify pictures, or even carry on a conversation. Every response acts like a real-time roadmap, helping the surgical team remove as much abnormal tissue as possible while protecting the parts of the brain responsible for speech, movement, memory, and ultimately the parts that make you, you. This is part of the reason this procedure is so gnarly. Just imagine the mental side of that. You know your brain is exposed. You're talking with your surgical team, knowing that every word you say is helping guide the operation. It may sound like one of the most terrifying procedures. Number 4, awake intubation. Now this next one is both physically uncomfortable and mentally rough. It's called an awake intubation. Picture a patient arriving in the emergency department. They're sitting upright because laying flat makes it even harder to breathe. Every breath is loud, labored, and becoming more difficult by the minute. But every ER doctor knows the same thing. That window to secure the airway is rapidly closing. Now, when most people think about getting a breathing tube, they picture someone who's completely asleep, and most of the time, that's exactly what happens. But in patients like this, putting them fully to sleep first can actually be the most dangerous thing you can do. Why, you may ask? That's because anesthesia relaxes the muscles that help keep the airway open. And if that already swollen or damaged airway collapses, it can become incredibly difficult, or in some cases impossible, to place a breathing tube. Don't get me wrong, patients receive numbing medication to the nose, mouth, and throat, and often medications to help them relax. But numb doesn't mean comfortable. Patients often describe gagging, coughing, and a deep feeling of pressure, and the overwhelming mental challenge of trying to stay calm while knowing exactly what's happening. Many patients say the anticipation is agonizing, but here's why doctors are willing to put patients through it. Once the breathing tube is safely in place, doctors can give strong anesthesia, fully support the patient's breathing, and proceed knowing the airway is finally secure. Number 3 most brutal procedure we do today, skin graft harvesting. This next procedure catches a lot of patients completely off guard. But surprisingly, the most painful part often isn't where the injury was, it's where the healthy skin comes from. Doctors perform skin grafts after devastating burns, severe trauma, major infections, or when large areas of damaged tissue have been surgically removed. Without healthy skin covering those wounds, patients face much higher risks of infection, fluid loss, poor healing, and permanent disability. So what do surgeons do to try and help the situation? They borrow healthy skin from another part of the body, most commonly the thigh, buttocks, or back, and transplant it over the injured area to help it heal, which sounds simple enough. But here's the part many patients never expect. The donor site often becomes the most painful wound on the entire body. That's because surgeons aren't removing a full piece of skin. Instead, they use a specialized instrument called the dermatome to shave away an extremely thin layer of healthy skin. That's why patients often describe the donor site as feeling like an enormous road rash, or severe rug burn, or even a second-degree burn that stretches across much of the leg. And every step of the process hurts. Number 2, necrotizing fasciitis debridement. Now, we're getting into truly vicious territory. This is the operation performed when someone develops necrotizing fasciitis, better known as flesh-eating bacterial infection, sometimes over the course of just a few hours. Patients may arrive complaining of excruciating pain that's completely out of proportion to what the skin looks like. At first, it may resemble nothing more than a small cut, but underneath, the infection is rapidly spreading through the fascia, the connective tissue that surrounds muscles, nerves, and blood vessels. As it advances, tissue begins to die. The skin can become swollen, dark purple, and eventually black as blood flow is lost. So what do surgeons have to do? They perform an aggressive operation called surgical debridement, physically cutting away every piece of infected and dying tissue until only healthy tissue remains. And here's what makes this one so insanely brutal. One surgery is almost never enough. Patients are frequently taken back to the operating room again and again, sometimes every 24 to 48 hours, because even if a small amount of dead infected tissue is left behind, the infection can continue spreading, and every hour that passes increases the risk of overwhelming sepsis, multi-organ failure, or worst of all, death. Number 1, emergency thoracotomy. And the number 1 spot on today's list goes to what may be the single most aggressive life-saving procedure in all of modern medicine, the emergency thoracotomy, or as many people know, cracking open the chest. Now, if this procedure is happening, it means just about everything else has already failed. This isn't a routine operation. This isn't something doctors casually decide to do. This is a last-ditch effort to save someone who is literally dying in front of them. Most commonly, it's performed after catastrophic trauma, or when the patient has lost vital signs or is only moments away from doing so. At that point, there isn't time to transport the patient to an operating room. Doctors like myself make a large incision across the left side of the chest and use a specialized rib spreader to separate the ribs, opening the chest cavity so they can reach the heart, lungs, and major blood vessels within seconds. Once the chest is open, doctors can perform interventions that simply aren't possible from outside the body. They may place a hand directly on the heart and manually squeeze it to generate circulation. They may even clamp the descending aorta to redirect the body's remaining blood toward the heart and brain. There is simply nothing else in emergency medicine quite like it. It's organized chaos, trying to bring someone back from the very edge of death. That's been a quick breakdown of 8 more of the most brutal medical procedures that still happen in modern medicine today. I'm curious, is there a medical procedure you've experienced that felt absolutely brutal? Let me know in the comments below. Also, if you enjoyed this video, go ahead and binge watch this playlist right here, where I break down even more wild things that happen in medicine. And don't forget to subscribe, turn on your bell notifications so you don't miss the next video. Thank you so much for watching, and stay healthy, my friends.